Yo, welcome to part 2 of the vlog series CO2 Laser My Face, where I bring you guys along on the journey that I've been on for like 5 years now, and what I'm going through, what happened, and what the ultimate goal is gonna be, of course. I'm gonna bring you guys along on whatever I'm gonna do about this, and all the stuff happening afterwards, of course, and the healing process, and yeah. Alright, so you might have seen part 1. If not, check it out, please. I'm going about the details of what has happened to me and how this all came to be. How I got into this position and what I'm about to do. Yeah, we're gonna talk about a little bit of what CO2 lasering is, about the visit that I had with the doctor, of the clinic, of the beauty clinic that I visited for this. And yeah, it's actually almost about time, like 2 weeks from now, I'm gonna be having my first CO2 laser sitting. Okay, so one thing before I say anything else, I'm very noob in lighting and how to set up the camera and stuff, but I'm getting better at it. I right now have 2 ring lights shining on my face, and I think I got the picture to be pretty clean and good, not overexposure or anything. However, I know it does not give the actual face, the actual picture of how my face look justice, or maybe it's just in my head. Anyways, let's have a look at my scars here. So as you can see, this is the main scar that is the biggest one as well. I would say it's like 3 to 4 centimeters big. It's going straight across my face. And the worst thing about it is when you look on my face like this, you just see like a dent kind of thing going on, and it's always a shadow, and it's wrecking my mind. Apart from this huge scar that I told you guys, of course, in the first video, how it came to be and stuff, there is a bunch of smaller ice pick scars, they are called. And much more, of course, on this side. As you can see, an insane amounts of ice pick scars. And yeah. Okay, so this is the picture that I can provide you guys now. I'm gonna try and look for more pictures with the best resolution and lighting that I can get, just so you guys can see it. However, they're not going to be posted in this video, probably in an update on the day or the day before I do the laser thingy. And yeah, so much for that now. But I think you guys can see that this is some serious scarring going on. And remember, this is now 5 years old. I want to say, I never had acne in my face as other people would have throughout their youth, and I was always very grateful for that. All those ice pick scars and everything you see here happened all at once, all during COVID, and it was a crazy time and a very depressing time. All the multiple scars you see that are a little bit further from the main scar, which is this and this one, all have to do with these scars, as in that the cyst would have been leaked within and tried to, escape through other areas. So it's a pretty serious thing. The whole cheek basically is contaminated, and that's where we are now. To add to the current situation, a little bit of information. I still have cysts, especially on this side. Here and here are two cysts, and here, where is it? And here, it's mirrored. It's like symmetrical in my face. And the ones on this side, actually these are more severe. They would come back every 2 to 3 months, sometimes monthly. Just get inflamed and infected by themselves. I don't have to do anything about it. I have my usual skincare routine, which I have to scrub and clean my face at least once a day. Most of the time I do it after waking up, because that's when you got all the dirt and stuff from pillow or whatever squeezed into your face while you have your face on the pillow all the time. And then throughout the day, you want to have it clean so it does not clog up the pores. But yeah, so they would just get infected and swollen and big, and then at some point where when I see the white coming shining through the skin, I would pop them myself because it is very painful and I do not want to have them pop on my pillow or whatever. I know people say do not pop them yourself, and I also say do not pop them yourself. But I'm having this sounds stupid, but I'm having experience in this, and I really know when I can pop them and when not. Even though, and I have to stress again, every doctor as well said do never pop them. It is just something that I have to do because I know it's gonna fasten the process of them popping and then healing again. I might be stupid for it. I've talked to several doctors about it. All of them said no. And a few of them said, if you have to pop it, you have to pop it. Please let me know in the comments what you think about that. But that is how I'm going about this. Anyways, so they would come back well, every few months and then, get inflamed and just pop. So I'm having these cysts basically forever because if you don't get them cut out, then they're just gonna last forever. And I don't know when it stops. I read it's some hormonal stuff that whenever you start to become much older and your hormones basically stop fluctuating but just start declining, that is when it's gonna stop. And I don't know, like it's gonna take a few years more, I believe, but it's a true curse. And I really feel for all of you guys who have this since being very young in your teens through adulthood. And as I said, I'm just recently, or rather since COVID, having this plague on me. I really feel so much for you guys. Hang in there, please. It's something that is gonna go away, and you just have to take care of yourself and just go through everything, all the literature that you can find about it, and apply. That's all I can say, you guys. But yeah, we're all in the same boat now, and I feel for you guys. All right, so I wanted to touch up on what actually the laser is, which clinic I'm going to, and how the whole procedure looks like. So I have prepared something here. This is the website of the clinic that I'm going to. They are called Aesthetic, and this is all in German, but you get the gist, I believe. So they have a bunch of places in Germany, and they seem pretty exclusive. So as to they have a high rating, and especially the place that I am going to, they have like a 5-star rating, full stars, and I feel really good going to them, talking to them. They make me feel really good about it. After all, you're paying them a bunch of money, so that is like the least you can expect. But no, really, I have to take it and have to give them props for that. So the doctor I was talking to, he really seems to know his stuff, although he's a young guy, and because he was a little bit on the younger side, like something my age, I could really feel the connection with him, and I could talk to him, you know, without any issues. And it was a good experience having the appointment with them. And yeah, in 2 weeks I have the first sitting, so that is what's gonna happen. Um, how does CO2 laser actually work? So the way he explained it to me, the best thing I could find as a graphic would be this one. It's a very poor video quality, but I think you guys will understand what's going on. So you are literally being shot with lasers into your skin, microscopic size, of course, and then let it go to the next picture so I can continue narrating this. So this is the laser head. It went into the skin, and then it shot all these rays into your skin at a specific depth. And you see how it goes through multiple layers of the skin, which is very, very necessary in order to basically do enough damage to the skin so the skin would try and heal it, but not only heal it on the surface, but really have the collagen synthesis, I think it's called. Please excuse me if I don't know the lingo. Which is activated once you go very deep in the tissue as such, here down here. And therefore, once the collagen synthesis gets activated and the healing process starts, You see how the skin on the surface is flattening out. And I know this looks like magic, and how can this be? Like, this looks so good. Like, the picture on the second side. Can you guys see my mouse? I think it's in the screen. Like, how is this possible? I was skeptical as too, but the doctor that I was talking to, he showed me pictures of his patients on his phone, and they looked amazing. He showed me before and after pictures, and I cannot fathom. It is like really good, and I was looking to see if there's any makeup or anything. No, but it is like the, it is a patient picture, and it is amazing results. So this is how all of this works. And if you look on YouTube, wow, I just shocked you, right? I'm so sorry. I should have prepared this better. This is one day after. This is a lady that got her whole face lasered, and this is one day after the lasering. I wanted to say a note. If you look on before and after laser things on Google, I couldn't find much. This video though I find was very good because you can see the before and after. On other videos it's all kind of clickbait, and they're not really showing the before and after, so I'm really confused. I went through like a bunch of videos, and this is like the best one I can find. So I'm sorry for the shock, but this is how this looks like. And the pictures that the doctor showed me on his phone, they looked exactly like this. He showed me the before and after, and the healing procedure and the healing process stages of several of his patients. It was a long talk that we had, like at least like half an hour, 40 minutes. And they look like this. So you can see um, the things on this woman's cheek aside. I think she got like a lifting here for the eyelids. So just ignore this. But everything else you can see here, I guess she has some cream or like some fatty salve or something on her face just to moisturize. You can see that the skin is pretty damaged, so it is very red and very yeah. It is a wound. Like the whole thing is a wound. And you can see now she did her whole face, which is yeah, I guess for lifting purposes. Which in my case this would just be my whole cheeks, right? And on both sides. So I'm very much looking forward to this. Not, but let's see more pictures. So this is one day after the lasering, yeah. So this is how this woman looks like, and then day 3, 4 after, you can see it looks better, but it still looks brutal. So he also told me that it's gonna be very brutal and it's gonna be very painful. I told him pain is no problem. I want you to be completely honest with me. Tell me everything about it. I need to know everything. He said, okay, look, I'm gonna take you really rough, and it's gonna be very painful. I'm gonna crank up the laser. That's what he said, to the max, and we're gonna do this. And I can just be thankful for the guy, being that honest and stuff to me. But that is how the pictures as well looked on the phone that he showed me, and he said after 1 week it should be like so much better, and we're gonna see how this gonna look after 1 week. But as you can see, during all this time you're gonna have to have something applied on your face just to keep it moisturized, just to keep the healing process, just to accelerate the healing process. And then on day 6 you can see this woman's scabs are falling off, and she looks, not as red anymore, not as damaged anymore. And yeah, the cheeks looks really weird. This is freaking me out. But you have to ignore this piece right now, because this is, as I said, not part of the laser fraction. So this woman, as I understood, she did an eye lift and the laser at the same time. But as you can see, day 6 and then come day 7, her skin actually looks healed. Look at this. And the crazy thing about this, if there was a scar, the scar would have been lighter, much, much, much lighter. Why do I say lighter and not completely gone? The doctor said to me, in some cases, one sitting is not enough. You can expect people to have 3 to 8 sittings. Each sitting costs $500 roughly, and it is very, very expensive. The reason why I chose this one clinic was specifically because they had a high rating, and I was able to pay them monthly and not all at the same time. There were some issues with my payment right now, where I could not be paying them monthly, but I have to pay all at once. And because I'm doing both sides, you can guess how expensive it's gonna be. But I made a small deal with him, and yeah, I still have to pay all at once, but it's gonna be a little bit better price for me. And that's all I wanna say. Like, I'm not gonna talk prices and stuff, but Yeah, so it's expensive, and it is something that I really want to tackle, no matter what price. But it just has to be done. I donated a bunch of blood just to save money up for this, and it feels good spending it for this. It's like I have to do this, and my confidence is in the gutter. I'm telling you, when I'm streaming, when I'm looking at the camera, every time I catch this hole in my face, and it is just a big strain on my mental, and I just have to do it no matter the price. If it costs 1k bucks, then it costs 1k bucks. If it's one sitting out of eight, then yeah, I'm gonna have to be donating more blood, I suppose. Anyways, to this procedure that I'm doing now, I wanted to add something else. It is like this. So I'm doing this in February now, and then the healing process has to be monitored over several months, over 1 or 2 months. That means February, March, and then April. And then around April time, the sun should be out much more, and summertime, springtime should be kicking in. That is when you do not want to have this laser therapy going on your face, because as far as I understand, if you expose yourself to sunlight during the healing process, you can, if you are as dark as I am in my skin, um, you can have a strong pigmentation where the skin would be healthy and healing and everything, but it would be colored, like a pigmentation would be occurring. So this is the only sitting that I can do up until winter this year. So in case the first sitting is not giving me the expected results or the results that I want to, we're gonna have another one, but earliest in winter. So that's something that I wanted to add. All right, so you can see the woman then a few weeks. I think this is 2 weeks afterwards. Her skin looks amazing, and you cannot believe that she underwent this treatment basically, and not even the eyelids thing. Now I don't see it. It looks amazing. It doesn't seem that she has any makeup on, and yeah, it's amazing. So a few more things that I wanted to add for the pictures that I saw on his phone, or was it a camera? It was something he showed me. The results were, as I said, amazing. Like you can see the woman right here. But in my case, he actually said, because the scar is so big and nasty, we're gonna try lasering first. If it doesn't work though, in my case, he said he could cut out the whole thing and re-saw it and make it look better. So I did not think about this at all. I do not really understand how it's supposed to, how it's supposed to work. He's gonna cut out a whole chunk of my cheek. But then he showed me a picture of a patient where he did it. And by the way, the patients that visit him, their faces, wow, like people have really bad burn scars, and that's not like acne or something, but like accidents. And yeah, this looks rough on me, but the people that I saw on these pictures, wow. And then the results that came out of this were even more amazing. Like, so this one woman, she had her whole side of the face burned, and there was a really nasty scar going all across her face. And then he showed me the before and after. They cut out all of the face, all of the scar, and then 2 weeks later, it already looked so much better. And I cannot believe how it's working. It has to be some sort of, the healing process has to be, I don't really know how it works. They put on something, but it's crazy. So yeah, we're gonna do the lasering now and see how it works. It's gonna be both sides. As I said, this one huge scar, which probably gonna need more lasering. It depends also how your skin is gonna react. There's a lot of factors in this. And then the scar that goes like this. All the ice pickle scars around it, he said he's gonna do for free as like an extra. But yeah, I'm very thankful for him. And until he showed me the ice pickle scars, and I showed you now, I wasn't even aware that I have that many and that deep ones. And these are basically cysts that I would have cut or squeezed out myself or punctured myself. And that is why you guys don't do this, yeah. Apart from infections and other stuff. But yeah, so very, very much looking forward for it. In 2 weeks, it's gonna happen. And yeah, you guys can see the scar looks nasty as F. This is now 5 years later. You can imagine how crazy it was before. I was almost proud running around with this in my face, but not really. Another thing that I wanted to touch on was, you see how I have this dent in here? On this scar, I'm touching upon it in the first video, check it out. But I talked to him about his dent as well. He said, I talked to him about how I'm bulking, cutting, you know, from season to season and stuff. And he said, look, once you are done with basically bodybuilding or, you know, bulking and cutting, and go to your leanest, because when I'm the leanest, especially in this summer, it was very noticeable because your face gets sucked in and then this just becomes more, you know, prominent. When you're on your leanest, we can look about some filament and then go from there. But basically, he said he can remove the dent by adding some filament. It is plastic surgery at this point, and I do not know if I want it. I might look at it, you know, if it's not too expensive. But also, it's something that is not lasting forever. So you would have to do this a few years every now and then. And I never thought I find myself in a position like this of having to care about my vanity and stuff, as really the only thing that is bothering me is this huge scar on the left side. But that is where I am now, and I keep you guys up to date. Alrighty, so I forgot to mention something very important, and this is in post edit. So in order to get my face lasered properly without any issues, I had to buy creams and apply them every night. And I wanted to show you guys which cream this was. So this one cost me roughly 30 bucks. Big Norm cream. Supposedly it just helps prep your skin for the laser and pigmentation, irritation, whatever it is. I didn't look too much into it. I'm just gonna trust the doctor. So this is what I have to apply. Yeah. So he said apply this for 10 minutes and then rinse your face, and then another thing that I have to apply also cost me around 30 bucks. This though usually costs much more, and I think I found like the cheapest one which was on sale currently. But these are very hard to find good ones, and especially ones with the ingredients that you need. So in my case, it is vitamin C serum, but it had to be 20% strong. So I think that's 20% vitamin C, and then 80% something else. But that's how the thing has to be. And if you're looking at on Amazon or anywhere, you can find cheaper that claim that they have even more percentage or whatever. But so I'm not really like a vanity guy or skin serum guy. I never applied this kind of stuff to my face. But I was researching, of course, a lot, and people say don't trust anything you ever read on any label. And if you want a good quality, you have to pay a lot of money, and even then you're gonna get scammed. So this was the only one that I found that also had, it's not focusing right now, but it says here that also had on the packaging stating 20%. Any other that I have seen did not have the 20% in the description or whatever, but only in the title, maybe just to, you know, clickbait or make you buy it. But anyways, yeah. So the consistency of this one is a little weird. I'll show you a little bit here. So this is how this looks like. And why I say this is weird is because once I apply it, it feels like it's a film of as if I applied honey, and then once it hardens, it's actually like a protective layer. I don't know. That is just like, you know, my comment on this as somebody who doesn't know anything about it. But so these are the things that I had to do, that I have to do, that you might have to do before you're getting your face lasered. And yeah, so this is gonna be the routine I'm doing for the last 2 weeks, and I'm gonna keep doing this for 2 more weeks, and then we can get lasered. So this was everything that I wanted to add. Thank you for watching. So yeah, I think that is the video. I was gonna touch upon a little bit on how the healing process was during after this. But I think I'll keep it for another video. I can elaborate on how exactly I felt and what exactly happened. I give you one little thing to take with you. When I got this cut, my face actually, this part, the whole part of my face, up until my nose and my eye. I didn't mention this, but this is wow. Like I cannot believe that I got over this. But this was completely numb for multiple years. I would say like 4 years or so. Just recently, basically in the last 2 years, I got a sensation, a feeling back. And the reason for this is when the doctor who did this cut in here, he actually severed a nerve. And guys, I was so scared for like what is happening to me. I talked about this with the doctor, and I'm gonna look. He told me that I should have sued, and I'm gonna look into this now because it's so long gone. I don't think there's anything to do, but I'm on a mission now, so I will see. But yeah, that happened, guys. And the moment, oh my god, I'm about to cry. The moment I got the sensation back was so good. I can't describe it. Okay, so that is it for now, I think. I'll keep you guys up to date. In 2 weeks, I'm gonna have the appointment, and yeah, I'll bring you through the whole healing process and everything. And hope it's interesting for you guys if you are in the same position and thinking you want to do the CO2 laser and you're thinking about it if it's too expensive or whatever. Maybe you can see how it's working on myself and then decide for yourself. But I'm having a very good feeling about this, and I'm going in. That is all for now, guys. I hope you can take something away from this video, and I wish you the best week of your life, and see you later. GG, thank you, bye.